Welcome back. February is National Children's Dental Health Month, and we know dental health is very important to your overall health. It's important to get a head start and create healthy habits at an early age. And Dr. David Austin, MHS Dental Director, is here this morning with a lot of helpful advice. And you practiced for what, more than 35 years before taking on this role. Let's start with this, early prevention. I remember when I first had my son 8 years ago, I had no clue they'd go to the dentist that quickly. What age do you recommend?
Well, we are really strong advocates of the first tooth, first visit. So when that first tooth comes in, which is typically around 6-7 months, that's when the child should first be seen, either by a pediatric dentist or maybe even their pediatrician.
Wow. Do you suggest, just a side question, that families find a place that's just for kids, or does that really matter?
It doesn't really matter. However, children's specialists are there for a reason. They went through that extra training so that they could be more focused on children's specific needs. When I think about my children, I didn't take them to my doctor, I took them to a pediatrician. So therefore, that's why I took them to a pediatric dentist.
Great point. Let's talk about sugar in food and drinks. What do parents need to know about navigating that?
Well, first thing, they need to limit the exposure, because it's not the amount of sugar that a child consumes, it's the length of time that it's in their mouth. So you really need to limit snacking time. Be careful of the sticky sweets that cling to the teeth and just kind of slowly dissolve over time. Be careful of sugary drinks. A lot of times the parents aren't aware of how much sugar the child is consuming just through drinks. And also, natural sugar is just as harmful to teeth as processed sugar. So switching soda for juice, really no benefit in that.
No benefit
sugar is
there.
sugar.
What about newborns? Can parents do anything?
Yeah, as soon as those first teeth come in, get an extra soft children's toothbrush and begin brushing them twice a day. Using just water, though, just a little water on the toothbrush. And again, encouraging them to get those visits with either a pediatric dentist or their pediatrician to check their growth and development. Maybe even put fluoride varnish on the teeth a couple times a year. That's another preventive strategy to help protect the children from early childhood tooth decay.
Wow, this is good info. I want to talk about insurance as well. I know my son's school, like a big bus comes and they can get dental stuff. What about people in those situations?
A lot of times, whoever the insurance provider is, there will be a list of all the places where they can get care, and sometimes there are some mobile units that will come to school. I think it's always a good idea for everybody in children specifically to have a dental home, somewhere that they can go on a regular basis where their record is kept and they have a good history of what's been going on with that child.
So important. Thank you so much. I hope my son's watching right now as he's sitting there getting ready for school. We really appreciate your time.
Thank you.
For more on MHS, we provided a link to their website on fox59.com/links, and this segment will be up later this morning. Dr. Austin, thank you.